Celebrating Nurses Week is our episode topic in this special Nurses Week edition of the BRG Nurse Executive Podcast. My guest is Dr. Brad Goettl, Chief Nursing Officer at the American Nurses Enterprise, where the American Nurses Association is celebrating its 130th anniversary. This episode was recorded back on January 23rd, the day before ICU nurse Alex Preddy's death in Minneapolis, and an opportunity to discuss his death and the provision 8.2 of the Nursing Code of Ethics, which states, and I quote, "The nursing profession holds that physical and mental health are universal human rights. Thus, the need for nursing is universal. Where there are human rights violations, nurses ought to and must stand up for those rights and demand accountability." End quote. We air this episode now as it was originally recorded. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Brad, thank you so much for joining us, and happy Nurses Week.
Yeah, happy Nurses Week. Thanks for having me. It's going to be great to connect with all your listeners.
Awesome. Before we get into our episode topic, can you share a little bit about yourself with our listeners?
I'm the Chief Nursing Officer for the American Nurses Enterprise, which is home to the American Nurses Association, which is our membership arm, the American Nurses Credentialing Center, which is, think about organizational credentials and board certification in our foundation. Been with the organization now just about a year in this role. Previously was the Chief Clinical Officer at the Emergency Nurses Association. And prior to these two roles, I spent the last 20 years working as a nurse in various capacities, whether that's been bedside in the emergency department as a flight nurse and nurse practitioner, but also spent a fair amount of time in academics and health system leadership.
Our topic today is celebrating Nurses Week. So what does this week personally mean to you as a nurse and as the American Nurses Enterprise's Chief Nursing Officer?
This is a really special time of the year for the American Nurses Association and nurses across the country. It's a time for us to celebrate and recognize the hard work of nurses in the profession as well. Not to just do that during 1 week, but this is an opportunity for us to really draw attention to it, not only just for recognition purposes, but help bring visibility to the community and the public around the value of nurses or across the different career stages. And it really is a powerful time for me to do some self-reflection and think about who's impacted my life, and think about my journey, and think about the nurses that have helped get me to where I am today. And also an opportunity for me to reflect on how I can best support the profession moving forward. It's always a good time to reset and think about what we're doing, think about where we're going, and think about how I can best support nurses at every stage.
From the enterprise's perspective, what is the current state of the nursing profession in the United States?
Yeah, nursing as a profession really is a pivotal moment. On one hand, nurses continue to demonstrate extraordinary resilience, innovation, leadership across each care setting. But we're still struggling to fill positions, and workforce challenges still persist across the country. We really have training capacity issues that rise front and center. We have 60,000 nurses that are qualified for nursing positions that apply to nursing school that don't get a training spot. A lot of that is training capacity and faculty shortages and disparities in pay and faculty. We also have geographical challenges. Rural, underserved areas have a harder time recruiting and retaining nurses. So workforce stuff remains front and center for the profession. But the passion for nursing hasn't changed, and the impact that we are having across the country and each of the patients and communities that we interact with, it's still a proud profession, most trusted profession in 24 years. Just recently, a Gallup poll said that, and it was even longer, except for during 9/11, the firefighters were the most trusted profession. So we really have been at the top as the most trusted and ethical profession for a very long time. And I see that will continue to be that into the future. We continue to struggle out of COVID with moral distress, burnout. I think that these are leftover challenges. Health systems and individuals are struggling with how to best support nurses in these environments. And we're seeing that there's been a little bit of a change and a little bit of turn, but we still continue to see issues with workplace violence. We see issues with toxicity and bullying, which we're tackling both at the local levels and systemic and larger levels as well. And those things still hold true.
You travel over the world really representing the nursing profession from the United States. And so, what are your colleagues, nurses practicing in the United States, telling you that they're most proud of? And on the flip side, that is their greatest area of concern?
Nurses everywhere I go speak to the impact that they have to patients, the communities, their health systems, and to each other. As nurses in this profession, we're the largest profession in the healthcare sector. There's a lot of opportunity for connectedness, that they still see opportunities for professional development and growth. Nursing a great profession. It allows for mobility. It allows for growth and professional development. And there is really no place you can't work as a nurse. We're seeing nurses show up not only providing direct care in various leadership roles, we're seeing them in industry, we're seeing people in politics and government affairs, and we're seeing folks in tech development and positions that maybe nurses weren't always thought of to be front and center. We're impacting much different. We're not just impacting one individual patient at a time. We're impacting whole health systems or ecosystems, or making an impact on how care is being delivered and developing new models of care and the support tools that go into place.
Burnout remains a major issue. So, what are the most effective strategies you're seeing to retain and also support nurses? And I guess it would probably be the other way around. You want to support them to be able to retain them.
Flexibility and work-life balance is a big part of retention and resilience. We see health systems thinking about different ways of staffing, whether that's flexible scheduling that are more conducive to being a parent and having home responsibilities, or other types of responsibilities that would require you to have some flexibility, self-scheduling, we used to call them, but short shifts where people can come and go, and thinking about how people can work in maybe different environments, and maybe they're splitting their time between working on a unit and then doing some virtual care so that they can break up their work schedules and get out of this kind of day-to-day activities where they're feeling swamped and not having a lot of variety in their work, the different float pools. And I think it really comes back to the support that we provide to one another as nurses, but also the support that health systems and employers are providing. And it has to go further than providing webinars or access to tools. It means really digging into improving workplace culture, improving where there is toxicity, improving where we see incivility and bullying, taking an active step towards preventing workplace violence, really no tolerance policies put in place. And we've seen some health systems deploy peer support programs that have been incredibly successful at improving resilience in the workplace. And the peer support programs and stress first aid programs in some of the health systems that we've worked with have seen great success in reducing turnover in departments. And a large health system in Florida is actually deploying this framework of peer support and stress first aid across their health system, and using it really as an exemplar, since they've seen such good outcomes with retention and employee engagement.
That kind of answers the next question, which was what progress has been made on mental health support for nurses?
The only thing I would say is there's still a stigma. And as much as we chip away at underlying mental health stigma, it still exists. And the American Nurses Association supports the Dr. Lorna Breen Reauthorization Act, which is really focuses on breaking down the stigma in mental health around reporting, unnecessary reporting, especially when it comes to licensing and certification. And the work still there's still a lot of work that goes into people not having fear to say that they might have an underlying depression or a previous substance use issue.
Well, while we're talking about policy, let's shift a little bit to policy and advocacy. And we know that things are changing very fast in DC, which is a little bit unusual for maybe the past several decades. We're recording this episode several months before Nurses Week, so keeping in mind that this may be a little bit outdated by the time that we release this episode. The enterprise does play a critical role in shaping health policy. What are the current policy priorities that are most urgent for nurses right now?
Workplace violence has been front and center for the American Nurses Association, really healthcare professionals for some time. We had the same advocacy when I was at the Emergency Nurses Association, really focusing on the value of health systems, hospitals having a strong workplace violence prevention plan. We're advocating that OSHA would build that into their standards as a federal standard, that every hospital that received Medicare or Medicaid dollars would have to build that workplace prevention plan. We've seen this work done at the state level. There's a number of states that have done it. Texas recently, just last year, has implemented it. We've seen success. And so that's one thing that's front and center for us. We continue to advocate and protect for the protection of Title VIII funding, which are workforce development dollars. We've done a number of engagements on the Hill, direct reach outs, letters to congressional leaders. We did a congressional briefing, and it was a topic that we talked about in our Hill Day conversations last year. There was a concern that there are significant, if not total, removal of Title VIII fundings for workforce development. And we're talking funding specifically for increasing repayment to faculty members. So encouraging folks to go into academics, diversity programs, rural health programs, the nursing core health core funding. Those funds were at risk and we advocated strongly to keep them in. We'll see if they make it into the new appropriations and the new budget. We're hoping the same thing with the National Institute for Nursing Research. There was a concern that funding would be pulled. So far, we've seen that the funding has remained pretty level from years past, but that was a big push for us to advocate for nursing research. We also have done a lot of work around the Department of Education and the description of the professional category. So Grad Plus loans and the changes that came out of the big, beautiful bill and which professions were going to fall into the category of graduate training versus professional training. And coming out of the RISE committee at the Department of Education, there was an old description from the 60s of when they described these two categories. And depending on which category your profession is in, made the difference on how much you could take out as in student loans. In the nursing profession, we know that the rising cost of education, that not everybody has equal access to education, and federal loans really make school accessible. Training programs, especially for advanced practice nurses, nurse practitioners, midwives, CRNAs, and CNSs, the cost of going to programs, especially CRNA programs where you can't work concurrently, really rely on federal loan programs. And so we've done a lot of work. We've done some grassroots work and some petitions. We've had over 250,000 signatures on a petition to introduce nursing into the professional category for the descriptions. And we have done a number of letters where people can go and tell their own stories of how federal loans help them achieve their goals. And without loans, what would have happened? Currently, we're a couple, like you said, we're recording a little bit early, but we're waiting for the proposed rule to come out from the Department of Education that will allow us to take additional action and provide additional feedback to the Department of Education. We're hoping that they'll take this feedback and that by the time you're listening to this podcast, we'll have a decision.
This potentially is a huge problem to make sure we have enough nurses coming into the profession, let alone how are we going to pay for it? But if people stop enrolling in school, we already got a shortage. That's just going to make things even worse. So if I'm a nurse leader, if I'm a nurse executive, if I'm a CNO right now, I'm like, my goodness, I've got this horrible staffing shortage and this is only going to make it worse. Do you have any recommendations on what I, as an executive, should do to try to bridge that gap?
Depending on where you're working, reach out to your government affairs team. The chief nursing, chief nurse executives that I've met with have met with the government affairs team to balance out where their priorities are, how they can help move the needle and have discussions both at the local level and national level, especially if they have representation in DC. The other place to stay informed is to go to rnaction.org. Our advocacy team, our government affairs team keeps that up to date with resources. Also, with RN Action, you can send letters to your congressional leaders directly from rnaction.org. You can tell your own stories, which will help feed additional advocacy and inform the work that we're doing. So I would say for any issue that pops up in nursing, that is a centralized place for you to go and follow. And a number of the issues that we talked about today are all on there. I would say reach out to your local schools, especially if you have academic practice partnerships in place, and speak to the government affairs team of the academic institutions, universities, and colleges, especially if you are having difficulty with the recruitment of advanced practice providers, graduate and doctorally prepared nurses into those roles, because those are the ones that are specifically impacted by this changes to the graduate loan categories. I talked to one health system recently, primarily children, or is a children's hospital, and only has one pediatric NP program in their region. And then also has difficulty recruiting CRNAs that have specialized pediatric training. And so in order for them to continue to recruit the professionals they need to do their job, these schools have to keep their seats filled. They're not putting out students fast enough to meet the needs of this local children's hospital. And this will make a big impact, especially for schools that have higher tuition rates.
And then more broadly, not specific to the issue around being able to fund your own education, how can nurse executives best advocate for both their nursing profession and advancing community care in their local community?
Advocacy is not always lobbying. A
Yeah.
lot of time, most of the time it's not, right? Nurses are natural advocates. We advocate for our patients and communities every day. Standing up for the profession and not losing track of that North Star. Understand where your nurses are coming from. Understand the issues and problems that they're having every single day, whether it is related to staffing. Listen to the discussions around compensation. Listen to the discussions around safety. Listen to the discussions around workplace violence and procedural things, and these shared governance structures that allow nurses to come together to help solve solutions and partners with the executive leadership. Having nurse leaders be visible, grounding, and not only hearing, but seeing the works of the teams that they're leading is essential. And if they're the voice in the C-suite, they can bring all of those experiences there, because not everybody in the C-suite is going to understand the lived experience of the nurse. You're all there for a particular reason: finance, executive officer, operations. They may not be able to fully understand or articulate the needs of the nurse. And that's our job as chief nurses, is to not only advance the organization, but make sure that nurses are represented.
What are your thoughts on the role of nurses evolving in areas like technology, AI, and care coordination?
Nurses need to be at the center of this conversation, not only in the development, but even prior to that. Nurses understand workflows. Nurses are closest to the problems. Nurses are therefore best positioned to help with the solution. So even if the nurse doesn't have all the technical background, maybe they do, but if they don't, they definitely can help when it comes to product design and what the end goal is. There's nothing worse than somebody bringing you a solution for a problem and they didn't actually solve the problem. They just brought you a new problem. And it's great that we're starting to see nurses not only brought into conversations, but actually leading the conversations. I was at Health this year and Vive this year, and it was amazing to see the amount of innovation that nurses are bringing to the table, the amount of technology that nurses are leading. The nurses that are serving in development roles or executive roles in technology and innovation, and I said earlier, I think the tables have turned on where nurses are showing up, and it's amazing. We have a lot to offer. If healthcare in this country is going to be solved, it's going to be because there's been nurses at the table.
What skills will be most important for the next generation of nurses? And how can nursing education adapt to better prepare nurses for both today and tomorrow's realities?
Care delivery continues to evolve. How and where we provide care and academic programs really are going to have to evolve to make sure that the competencies that we're assessing and the programs that we're delivering in are really up to date. Nurses coming out practice ready to be able to care for patients in today's world. So that means that we have to train in the use of artificial intelligence, the use of clinical decision support, how you challenge ethical conversation or challenge ethics in these types of situations. And we have to integrate that into every academic program. AI is not going away. It's not. Technology has been evolving, and it has been evolving in the last couple of years faster and faster. And we have to keep up. Academic centers, deans will also need to invest in their faculty, because in order to be able to build these programs, in order to deliver educational content and professional development that leads nurses to a specific set of competencies, that means the faculty have to evolve too. The technology that is in health systems is evolving so fast that certain faculty may have not had their hands on it. I know that even in the last 2 years that I've been out of clinical practice, the amount of clinical decision support and the evolution of electronic medical records and chart summary and ambient listening were all tools that we didn't have or were just coming out 2, 3 years ago. So that means that our faculty have to keep up too.
What gives you the most hope about the future of nursing?
I continue to see nurses lead in different ways every single day. Whether you are in a formal role or an informal role, we continue to really drive change in our healthcare system. We continue to push the needle further and raise the bar, and we are continuing to set expectations for our work environment. I think that the focus on healthy work environment is stronger now than ever before. A lot of the problems that we've been talking about here and for the last couple of years, they're not new. We've had workforce challenges for a really long time. We've had workplace balance for a really long time. We've had issues with staffing for a really long time. And I think we're getting a lot more attention to it. And the newer generations of nurses are making us do it. I think it's important. And these are the future leaders of healthcare, the future leaders of nursing. And I'm excited. I think that we have a bright future ahead. People continue to stand in line to come work in this profession. Now we just have to get them out the door, get them into the health systems, get them into our communities and help them.
How can nurses stay connected with the ANA and be part of shaping the future of the profession?
There's a lot of opportunity to be engaged. Of course, we'd love everybody to be an ANA member as a professional home for all nurses, no matter what specialty you are, what career stage you're in. We'd love for you to be a member and find opportunities to volunteer either in committee work or show up at Hill Day or be involved in your state association, get engaged in governance, whether that is being involved in a board position or a leadership position. But if you don't have time to do all of those things and you want to provide feedback, every time we put out a position statement, every time we revise scopes and standards, which the new ones that will be coming out this year, the 5th version of scopes and standards or our code of ethics, we're looking for feedback from nurses from across the country. So we put that out on all of our channels. If you have an opportunity to take and give feedback, that's one way that you can be engaged without a 2-term commitment or something like that. Also, follow our channels, our social channels. New opportunities present themselves. For instance, we just released a new Next Gen Ambassador program. We had our first class of Next Gen Ambassadors, and they've been plugged in to different parts of the organization. They showed up at the Magnet Conference, and they were able to experience the huge conference and all the excitement that goes along with that. They're being involved in governance stuff and leadership stuff. So follow our channels. And then you can always go to nursingworld.org. That's our website where you can keep up with the association, the credentialing center, and the foundation.
So you talked earlier that the American Nurses Enterprise, and one of the components, one of the entities of that is the American Nurses Credential Center. Now, I'm board certified in 2 certifications from ANCC. Why should a nurse focus on this? What's the value that ANCC really brings for board certifications to the profession?
Yeah, so the ANCC is really separated into two different buckets. It's our organizational accreditation portfolio. So we talk about Magnet, we talk about Pathway, nursing residency programs, and PTAP, and our advanced practice fellowship programs, and then also NCPD. Those programs are really meant to set the standards of excellence in health systems in those different areas. So health systems or organizations that achieve these accreditations really have met exemplar criteria and are investing back into their nurses and the environment in which they work. And the outcomes show that following these standards and achieving these accreditations are linked to better outcomes, not only for patients, but also for nurses' engagement. So that's one side of the portfolio. The other side is individual certification. So exciting this year, we broke 340,000 nurses that are board certified through the ANCC. A big chunk of that, majority of that are advanced practice nurses, but we have 17 board certifications that range from nurse practitioner, clinical nurse specialist to our nurse executive track certifications, and then a lot of the specialty tracks. And the value of certification is strong. Certification is a way for you to demonstrate that you're an expert in certain specialty or a certain practice. It's a way for you to show that not only for your self-recognition, but also show that to your peers and the community that you're an expert in this space.
Yeah. Any closing thoughts as we wrap up this episode?
I appreciate the opportunity to connect with America's nurses 1 year into my role, and I really am looking forward to the years to come and how we can best support nurses. Feel free to reach out and connect with me on LinkedIn, social channels, or through the ANA website, and appreciate the time.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.